right, so we're going to start off this afternoon session with Lisa Bonta Sumii. She's a psychotherapist, with over 23 years of experience. She's licensed to practice both in California and Nevada. She received her master's in social work from Smith College School for Social Work. And she's the first ever mental health and sports performance specialist for our Oakland Roots. Go Roots. She's also contracted to work with a lot of collegiate athletes at Cal State Bakersfield and also some other collegiate schools. She provides clinical mental health services and mental sport performance consultancies for NAIA and NJCAA student athletes nationwide. As in a direct response to a need for mental health services for youth athletes, Lisa founded Ath Mindset, which is a mental health service that has a diverse group or team of sport psychology professionals that serve youth across the nation. She's been quoted in Time Magazine, Teen Vogue, Women's Health Magazine, as well as been interviewed by BBC World. And we're so honored to have her today to present on the topic of returning to sports while managing the fear of re-injury. Welcome, Lisa.
Hello, everyone. Thanks for that introduction. Let me talk in the mic. Hi, everyone. Good afternoon. Thank you. I hope that your conference is going well yesterday and today. I'm just excited and happy to be here with you. Thank you, Dr. Rhonda, for that introduction. I first of all just want to acknowledge and appreciate the opportunity to have a professional like myself here at your sports medicine conference. I think it's the beginning of a new age, new era to have mental health be integrated into sports medicine discussions and conferences, so I appreciate the opportunity. This first slide is, of course, I gotta share a picture of my boys. These are the Oakland Roots. This was their pregame pick. Last week they had a game away. We have our new kits, so kind of sporting them, but just wanna just give a shout out to them real quick. And then I think Dr. Nick is in the house. Dr. Nick, are you still here? What up? Shout out to our sport doc right there. He's our team doc, and just a privilege to work alongside sports medicine staff for the overall care of our players. So let me see, I'm gonna do this technologically. Did it work? Oh, okay, no disclosures, I need to say that. But I just wanna start with sustaining an injury can be one of the most stressful occurrences an athlete will face during their athletic career. You all have a sense of that and have seen that and know that. From the moment an athlete sustains an injury to the moment they return to sport or transition out of their sport, athletes go through a wide range of emotions. Injured athletes often struggle with feeling isolated from their teammates and also experience emotions of fear, anxiety, and depression. So when you are treating them, we want to expect that. It doesn't mean that they're doing anything wrong or you're doing anything wrong. That's a natural emotional process the athletes are going to go through. I want to highlight the depression piece. The athletes feel like oftentimes there's a loss of their athletic identity, loss of their ability to perform and contribute to their team, loss of the ability to maybe play or start or have the minutes that they're used to, the loss of ability to travel. So all these ways that they connect, there's a loss there. And if we are to cite Elizabeth Kubler-Ross's stages of grief, depression is part of that. That doesn't mean they're gonna get clinically depressed, but the feelings of depression as a result from the loss can occur. Other things that they can experience that we can expect are denial. These are other stages of grief: denial, anger, bargaining, and acceptance. That's a circular process. It doesn't mean just because they feel denial, then they're gonna move on to anger and then denial's done. It's a circular process that they go through that you can keep an eye on when you're treating your patients. So I just wanted to highlight that piece there. When an athlete is injured, the focus is primarily on the physical healing process and not necessarily on the mental rehab the athlete needs. Support with both the emotional and physical factors involved with injury recovery is imperative for successful rehab and prevention of re-injury. And this is newish. This is newish. I think the roots, being able to provide a space and an opportunity for a professional like myself on their team really, really highlights that I want to take care of the player holistically. And I think that bringing in the emotional, mental aspect of healing and managing that fear, which is an emotional response and a temporary one. It's temporary and can be reappraised, meaning that if, we all know that our emotions can be physiologically manifested, right? So if they're feeling like in the MSK exam, right, that they can't relax, fear of even being touched or being examined, because what then is my doctor going to tell me? That I can't play anymore, which is really, really a tough scenario for them. But if we are able to address and notice that there are going to be adverse emotional reactions, then it normalizes their experience as well. That they're not, again, weak or not doing something right or paying too much attention to it. But if they have like the physiological feelings of fear, that can be like a tightness in the throat, butterflies, or anxiety, or sort of even a like feeling that you're going to throw up, that we can say like that is how your fear can actually live. Let's address it. Let's normalize it. Let's speak to it. Okay. Research shows that the use of mental skills training during injury recovery benefits the physical and mental well-being of athletes. Yet many athletes have limited, if any, exposure to expert mental training services specific to sports injury. So, our field is up and coming. We are making more of an impact on teams, on the youth level, collegiate level, and work interdisciplinary is really, really important. Like Dr. Rhonda had mentioned, I work in my company, Ath Mindset, with some collegiate athletes, and the athletic trainers are my point people. They're the ones that are the sort of the bridge between myself and the student athletes. And I think without them, it would be really, really tough. So how many athletic trainers in the house right now? Okay, thank you so much for all you do, appreciate you. But that collaborative way of being, again, in the service of the holistic care of the athletes is really, really important. So I wanted to talk about imagery, using imagery for mental rehab, okay? There are a lot of different mental tools we can use at different times of an athlete's career. Imagery is creating a mental likeness to something you would like to have occur in real life, okay? Imagery involves using all of your senses to create or recreate an experience. Imagery is different than visualization. Who's heard of visualization? Okay. So visualization is seeing what you want to occur. Imagery is engaging all senses, tasting, feeling, not just emotionally, but on the tactile level, tasting. Like right now, the lights are super hot, and so my upper lip is sweating, so I'm tasting my sweat right now. What are you hearing? What are you the full multidimensional, multisensorial experience? So we can use imagery to increase feelings of personal control, because a lot of our athletes are, I don't know what to do. I want to heal yesterday. And they want to be done and want to play and maybe even anger towards you. The person is telling them they can't play and all of that. But this is something they can do that's within their control. It breaks up the monotony of the physical rehab. So bringing in an imagery script, which I'll talk about in a second, can help with the physical rehab progressing and them feeling good about what they're doing. Potentially, it can enhance the rate of healing while decreasing the chances of re-injury. So the question is, how do we manage fear of re-injury? Will we address it and normalize it and talk about it with the original injury, if that makes sense, and even back it up even more, prevention of an injury, that we can keep our athletes and players healthy if we can teach them that the power of their mind and their brains can help them actually stay healthy. Research shows that if you are stressed in your life, you're more apt to be injured, because you approach then the situation tight, right? And then you're not able to flow, and then you do a quick movement or whatever your sport is, you're more apt to be injured. So that's an important piece of research I wanted to share as well. So let's talk about like what is imagery? How do we use it? We can train our athletes to use imagery and put them on a training schedule, or consult with someone like me. Dr. Bonta and I have worked on some mutual athletes together, but this is how we would kind of set the scene for them. Taking a few deep breaths, like deep breaths like this, right? That's a box breath. Who's heard of box breathing before? Okay, perfect. Integrating the box breathing. So I don't want to just say, take a few drips, go ahead and do it. You want to show them. So it's like on the one side of the box, inhale by 4, stay at the top for 4, exhale for 4, and stay at the bottom for 4. That's one box. Depending on your assessment of the level of comfort that your athlete's in, you can do more. But that just tells the brain that everything's okay, that we're safe, that we're not like breathing up at the top here. That just makes it more anxiety provoking for them. Tell them to close your eyes and create a vivid and convincing image. That's a process that we can do away. So it's creating an imagery script that they can write out like a creative writing project. If there is, I'm excited. I'm gonna get to the next one. The next slide that talks about what exactly the imagery is. While you are imaging or mentally rehearsing is another word we can use, you maintain a positive attitude, have realistic expectations, like this ain't gonna change overnight. When we train on our physical skills, it doesn't happen all of a sudden, right? We have to keep training and training until you get to that mastery and confident level. Same with mental skills. Using all of your senses, like I said, to create imagery seen as realistic as possible. You can even put a moment of adversity in there and then moving through that adversity, imaging it, because we know like if we just imagine an awesome, like fully excellent, successful image, it's not preparing us for the adversity that might come. If your imagery session is not going the way you want to, you can stop it and start over, and that piece about always being in control. Having our athletes feel like they are in control, like it's not happening to them, that they are more proactive in their process. And then the training includes holding regular imagery sessions, maybe once every other day, and you can assess, what's realistic for the age of your athlete, what is realistic for them, and assessing their already existing schedule. So, okay, this is the one I've been like waiting for. This is an example of an imagery script. Okay. We are going to adjust it, customize it, personalize it based on, again, the age of our athletes, where they're at, what you think they're able to do. So I'm going to have I was watching on the MSK exam, there's a practice piece, right? A training practice piece. So we're going to do that too. So I'm going to lead you through this. I always feel like as professionals and people who are teaching that we should experience it also and then have a better sense of how we can teach it and explain it to others. So I'm gonna have y'all do this with me, okay? So get in a comfortable spot, not too relaxed, like as if there is a rope extending from the top of your head, pulling you up so you're erect but relaxed, okay? You don't have to close your eyes, but I will ask you to take a few deep breaths. Concentrate on your breathing. Feel the movements of your body. Allow yourself to relax and sink into your chair. Now we're going to imagine that you're focusing your attention on your hurt knee. We're imagining that we have our hurt knee, so we're focusing our attention there. Notice what it feels like. See what it looks like. The swelling, bruising. Concentrate with your mind on reducing the swelling. See it actually shrinking and going down. Imagine a leak in your knee and see some of the fluid drain out. How does that physically feel? See your knee returning to its normal size. Concentrate again on the swelling going down. As your swelling reduces, notice your knee feeling more normal. And let's breathe. Now turn your attention to feeling the knee getting stronger. See the ligaments coming together. Feel the ligaments getting tighter, growing together. Concentrate on the fibers getting bigger, stronger, tighter. Feel your knee getting stronger. Take one more deep breath and we'll come back to the room. And if your eyes were closed, you can open them and become present to this space, this moment. There was another paragraph I could have guided you through, but I was like, it's fine. You guys get it. Y'all get it. And, you can obviously change out what the injury is, if it's a knee, and adapt it. But this is a sense. You can give them an example and you can work with them or instruct their parent to help them with creating their own imagery script. And then the training would be, while they're recovering, to actually read this out loud. They can also record it and listen to it. They can write it. And not type it on the computer. We don't want to disrupt the sort of more fluid process of direct brain to body kind of action. We don't want to put a computer in between that. But this is something that, again, they can feel comfortable with. And one example of how we can use mental skills to not only prevent injury, but manage the fear of re-injury. So in closing, I want to leave some time for some thoughts and questions maybe that you might have. Mental recovery from injury is just as important as physical recovery, and you can integrate it. Even in the MSK exam that you guys were doing, there was some folks who weren't even our people who were helping out, they weren't relaxing enough. And so we can tell them, there are the athletes, right? Breathe, just breathe. Because then it helps you do your exams and your interactions a little bit easier when they are calm, right? Coping with an injury is often experienced as a loss of control, so helping them identify what is in their control and exercising that control is key. Reminding the athlete that they are more than their injury, okay? They're more than their injury and they're more than their athletic identity. They're also a brother, a sister, a son, a daughter, a teammate, right? And having them see their full identity expand, and that this is a temporary state of being, and we're going to move through it. Fear is the emotional state that is not only temporary, but can be actively reappraised and assigned a different meaning. What it feels to be scared can be redefined and reframed. Working with them to do so, whatever that can mean for them, okay? Just some references, and then some resources. The Association for Applied Sports Psychology is one of the professional organizations I am a member of. And then one of my colleagues, Carrie Jackson, does an Injured Athletes Club podcast, 10 to 15 minutes of tips, ways to deal and cope, help the parent and the athlete deal with injury. And then she also has a book that Rebound, which has a lot of exercises and worksheets and things that can be keep the athlete engaged in their own recovery. So thank you very much. Appreciate you.